Production and distribution of City Club forums on IdeaStream are made possible by the generous support of PNC, the Chautauqua Institution, and the United Black Fund of Greater Cleveland, Incorporated.
Hello and welcome to the City Club of Cleveland. I'm Dan Moulthrop, Chief Executive of the City Club and a proud member. It's May 22nd, and as we take these first steps towards reopening the economy and reopening the state, your City Club is continuing with our virtual forums and still presenting here our Friday forums from the studios of 90.3 WCPN IdeaStream, our public media partner. We're very grateful for their partnership and support. We all know that the coronavirus pandemic has put an incredible amount of pressure on the American healthcare system. A shortage of both supplies and healthcare workers, sharply declining revenues from the cancellation of elective procedures and surgeries, and massive health insurance losses due to unemployment has shaken the foundation of our country's healthcare infrastructure. As states begin to reopen and as the number of coronavirus deaths and cases is expected to plateau, we have the chance to examine what's working, and perhaps more importantly, what's not working when it comes to the ways in which we deliver healthcare. Today, we'll talk to two local hospital CEOs who are also physicians about the pandemic, the changes their hospitals needed to make, and what the future of healthcare delivery might entail. Before I introduce our speakers, I'd like to take a quick moment to thank our generous members and sponsors and donors who support these virtual forums. For a full list, please visit us at cityclub.org/thankyou. And you can join them in supporting our work when you make a contribution online or become a member at cityclub.org. Now to our speakers. Dr. Akram Boutros is the president and CEO of the Metro Health System. He arrived at Metro in 2013 and has worked to revitalize that main campus, including the construction of a new hospital building and improving economic conditions in the surrounding West Side neighborhood. Before coming to Cleveland, Dr. Boutros was a consultant for hospital turnarounds and an administrator at St. Francis Hospital in New York. Also with us is Dr. Tom Mihalovic. He's president and CEO of Cleveland Clinic. Tom joined Cleveland Clinic in 2004 as a cardiothoracic surgeon specializing in minimally invasive and robotically assisted cardiac surgeries. Prior to being appointed CEO in 2018, Dr. Mihalovic served as CEO of Cleveland Clinic Abu Dhabi for 3 years, overseeing the hospital's strategy and operations as the first U.S. multi-specialty hospital to be replicated outside of North America. Now, as with every City Club forum, you can participate with your questions. Just text them to 330-541-5794, and we will put them into the second half of the program. That's 330-541-5794 to text your questions. And if you're on Twitter, just tweet them at the City Club, and we'll work them in. Doctors Boutros and Mihalovic, we're so glad to have you both back. Welcome again to the City Club of Cleveland, and thank you both for the vital work you've been leading.
Thank you, Dan. Thank you for having us.
Dr. Boutros, I want to start with you. As the stay-at-home orders have been lifted and sort of transformed into strong recommendations, businesses are reopening, commercial activity is coming back. Your hospital put out a model suggesting to us all that we expect a sharp increase in cases. Can you talk a little bit about that?
Sure. So, when I was with you in early March during the first City Club interview about coronavirus, I said the curse of public health is that if you do your job well and people don't get sick or die in great numbers, some people are going to think you are just overreacting. Ohio did a tremendous job. We responded a very responsible way, and we crushed the curve. As a result, what initially was expected to be 60,000 cases came down to 10,000 cases a day to 2,000 cases, and now we're hovering around 500 to 700 new cases a day. As more people interact, we're going to see that number increase. Could be to 900 to 1,500, but it will come back down again in our model.
Dr. Mihalovic, as cases are almost guaranteed to increase given the reopening of the economy, what's different at the Cleveland Clinic today than the situation 3 months ago when you were anticipating the first surge?
Well, a lot has changed over the past several months. I think first and foremost, the public awareness about the disease has changed tremendously. The information that we have gathered, new knowledge, I think that all of you, our listeners today have a very good understanding of a pandemic, but also do understand how to behave in a new environment. The social distancing, cough hygiene, the cough etiquette, and sanitary measures have really, I believe, that are going to significantly improve the safety of work environments and the overall safety environment out there in our communities. On the hospital front, a lot has changed. Over the last 3 months, we have jointly worked to ramp up our capacity to take care of COVID patients. Fortunately for us here in Ohio, we have not seen a large wave that our colleagues in New York and Detroit have experienced. But also the hospital environments has changed in very many ways. We are now screening all of our visitors and employees through temperature screenings and the entry points to the hospital. All of our employees, our caregivers, wear masks in the hospital environment. We strongly encourage visitors and patients to do the same. Social distancing is prevalent, and our ability to test has increased exponentially from the beginning of pandemic. And through those measures, we have been able to create a safe environment for care. It is really important to emphasize that the hospitals are a safe environment for care. And in the case of Cleveland Clinic, fewer than 1% of our caregivers have shown signs of infection. We have no evidence that any of them has become infected during work, most likely gotten infected in their own environments. And currently, out of 60,000 caregivers, only 5 of them are hospitalized and being treated for COVID infection.
Dr. Mihalovic, you said that we didn't get the wave that Detroit encountered. Apart from luck, why is that?
I think the early recognition of the importance of public safety measures by our government was a decisive step. I would like to think that also the coordination, unprecedented collaboration and coordination among healthcare providers and the government has resulted in a really exceptional outcome for the state of Ohio.
Dr. Boutros, go ahead.
I want to add 2 things. One is that if you look at the difference between Michigan and Ohio, one critical issue will be the election day, where Ohio didn't have had postponed it and Michigan did not. That contact of that number of people is going to demonstrate that it is the single biggest change between Ohio and Michigan. The second thing I would say is that regarding safety in hospitals, as Dr. Mihalovic was saying, safety is our priority every day. But because of the additional measures he described, our facilities have never been safer. So I would say is that hospital facilities today are safer than they were before the pandemic.
I know that part of the reason that message is so important to both of you and for both of you to get out to the community is because so many people have delayed not only elective procedures but also medically necessary health care because of fear of COVID and that going to the hospital would put them at risk. Do you want to talk a little bit about the dangers of delaying necessary medical care? Dr. Boutros?
I would say is that, when we initially told people to limit their contact with the healthcare system, hospitals and emergency room and the like, because we wanted to limit unnecessary exposure for vulnerable patients and healthcare workers. And that absolutely has worked. But now Epic Corporation, which has the largest number of electronic medical record, has just shown data that for over 3 million patients, that we've seen an abrupt drop between 86 and 94% in preventive cancer screenings for cervical cancer, colon cancer, and breast cancer compared to prior years. Emergency room and hospital admissions for heart attacks have decreased by 45%, strokes by 38%, and childhood immunizations are also decreased by 44%. So for me, we can't neglect the proven medical interventions or preventive care. I am very concerned, I'm sure as Dr. Mahalovic is, that we're likely to have a far worse secondary health crisis due to delays than the coronavirus spread may have an impact on us.
Dr. Akam-Boutros is CEO of the Metro Health System. Also with us here at the City Club Friday Forum, Dr. Tom Mahalovic. Dr. Mahalovic, with respect to elective procedures and other non-COVID related medical care, that's where hospitals like the Cleveland Clinic make a lot of the money that supports the overall operations. This is a national story that healthcare systems are finding the revenue that they've relied on to operate has decreased significantly. How much of a problem is this for the future of healthcare?
It is a tremendous problem for the future of healthcare because the financial impact on healthcare has been tremendous. 1.2 million healthcare workers lost their jobs in the midst of the largest healthcare crisis in U.S. history, which is a paradox of its own. At the time when our communities need our help and support more than ever, very many hospitals, all hospitals, are struggled due to this unprecedented financial loss. So that is a real issue because the demand for healthcare services will not disappear. In contrast to very many other industries, demand for our services is here to stay and is most likely going to be increased for the reasons that we just mentioned. Deferment of care has created a lot of pent-up demand, and I believe that this is going to be yet another challenge to healthcare industry to meet the needs of people who we care for.
So what about the challenge to the business model? I mean, does this point to some other solutions to, regarding who pays for hospitals? Should hospitals, I know that hospitals run on a very tight sort of capacity model so that you're running at, I don't know what the figure is, 70, 80, 90% capacity so that every room and every bed can generate revenue. But in a capacity situation like that, you may not have the ability to manage a surge.
Oh, absolutely. So we have created a lot of additional capacity in the meantime. But when it comes to differences in a business model, and I'd rather use the term the ways that we provide care and care for patients, healthcare industry as a whole has reacted in a way that it always does. There's a lot of innovation taking place at an accelerated pace. We are now delivering more and more care using digital means. Telehealth services have exploded in its popularity, and they've been embraced warmly by patients as well as providers. In Cleveland Clinic's example, right before COVID pandemic, we were providing about 5,000 healthcare visits using telehealth and digital platform a month. Currently, that number is up to 200,000. So more than half of all of our outpatient visits are being provided using the digital platform. And I do believe that this is a significant improvement, and it will allow us also in the future to provide services at a much more acceptable and much more affordable way.
Dr. Boutros, have you seen a similar increase in use of telemedicine?
Yeah, we went, Dr. Mahalovic and the Cleveland Clinic was using telehealth more than we were. We were about at 0.5% of our outpatient visits were being delivered by telemedicine. We went up to 85%, and we're now hovering around 50% of our services being provided through telephone and video. But, Dan, you asked a question about the financial hit America's hospitals. And I think Ohio Hospital Association has calculated that we're losing $1.2 billion of revenue a month for the Ohio hospitals. And Dr. Mahalovic talked about the millions of, the over a million healthcare workers who lost their job. Well, this pandemic has really uncovered for us at Metro Health the fragile financial health of many of our workers. We've seen it manifest in different ways. That's why we have not furloughed anybody. We have kept everybody working and switched them to different areas. And I'm really proud. Yesterday, the Metro Health Foundation has given us a grant to provide frontline workers a 2.25% raise this year, so that they can continue to care for their families and juggle all the stresses at home. And as Dr. Mahalovic said, we're going to need every healthcare worker to be available for the future.
I want to ask you both about the Minority Health Task Force, Strike Force, rather, that Governor DeWine convened, which was included, the report out was included as part of the press conference yesterday. The disproportionate impacts of COVID-19 on African Americans and other communities of color has been a huge piece of the learnings of the last 3 months. But for people in healthcare, it wasn't much of a surprise. Can you both talk about what your institutions are doing to address the underlying causes, the systemic racism, structural racism, and implicit bias that is involved in creating the conditions under which African Americans find a disproportionate impact of events like COVID-19? Akram Boutros?
Yeah, so if you remember, then last June, I spoke about structural racism and how social determinants of health negatively impact racial and ethnic minorities. We then put together the Institute for Hope, which has been highly active in dealing with the underlying social determinants of health, everything from food insecurity to housing to jobs and the like. For us, one of the things we've done is we've looked at our own coronavirus testing and COVID cases, and what we found is that testing and hospital admissions are reflective of the population demographics, but ICU admissions really demonstrate the disparities. And that is really due to the health conditions and age of the patients who are coming in. For us, this is another wake-up call. Going forward, we as a community and nation must commit to ourselves to addressing these disparities. And we've begun by working with the Cuyahoga County Health Department by going to different localities to test high-risk populations. We were just at the Word Church, I think, yesterday, and tested a couple of hundred people who to make sure that they are getting the testing necessary.
Dr. Mahalovic?
Yeah, I think that is certainly a phenomenon that comes as no surprise for us who are in a healthcare profession. Unfortunately, both of our organizations, as well as a broader healthcare community here in Cleveland and Northeast Ohio, have been actually working together. This has been an unprecedented joint effort to address the disparities in a healthcare delivery during a pandemic. Here on Cleveland Clinic side, in collaboration with the university hospitals and our, so to say, next door neighbor, we opened the first drive-through testing site that was available for patients that are being treated by our caregivers. And since we opened our first site here, the Walker Center, We have opened 5 or 6 additional sites, and there are additional sites that are going to be available for the testing, and they're going to be dispersed through the communities all the way from Akron up here to Cleveland. So the testing capacity is there. Additional efforts were focused on education as well as a provision of not only educational materials, but the life's necessities, everything from sanitation materials to food to direct outreach. And we have also ramped up our capacity to deliver care at home, knowing that very many of our patients are concerned and scared about coming to the hospitals. We have decided to come to their own home to deliver the care that they need. And that has been warmly welcomed, and I think it's been a very effective measure.
Dr. Mahalovic, I want to ask you about what happened early in the crisis, early in this pandemic. There was a shortage of PPE, of personal protective equipment, a shortage of ventilators, and a lot of concerns that as a nation, we did not have a public health system and a supply system and a logistics system that was ready for such a crisis as we were experiencing. The Cleveland Clinic delivers care both in the United States and internationally, and as a world-renowned hospital, you're part of conversations that go far beyond our borders. And I just wanted to ask you to comment on the relative level of preparation that our nation had and what you think ought to be different in the future.
Well, I think it is probably most important thing is to provide the context about this pandemic and state simply that there is no nation, to my knowledge, that was well prepared to meet a pandemic of this proportion. This is a phenomenon that we've never encountered in the past, and certainly a phenomenon that has taught us and continues to teach us very many lessons. But speaking about, first of all, us as a system, and then briefly about the nationwide efforts. The Cleveland Clinic, as you mentioned, we have a Cleveland Clinic presence in the United Arab Emirates, and that is how we learned about the dangers of pandemic and complexity of a care for patients with COVID-19, because they had experiences in taking care of those patients before pandemic arrived to the United States. Since we are in a daily contact with our colleagues in Abu Dhabi, we started immediately in January to prepare our system for COVID pandemic, but making sure that we have an appropriate resources, in particular personal protective equipment, at our disposal. As the pandemic unraveled, I think what we have seen, and not only here in Ohio, but also federally, nationally, the collaborative efforts that I believe is something that we can be very proud of. Very many of us have participated. All of us have participated here in Ohio in sharing our resources and knowledge, as well as our analytical capability. We have collaborated very, very closely with our governor and his office, and I believe that the success of that collaboration is evident. At the federal level, if you take a look just at the ability to get the personal protective equipment in different parts of the country, I think this has not been perfect, but in very many instances has been far, far better than in some other countries that were struck with the COVID pandemic. And then we also shared other resources like a virtual ventilator bank, where very many large providers have committed a part of their inventory for centers that were hit hard, such as New York and Detroit. And lastly, I would just like to say we have also seen very many caregivers and healthcare professionals stepping up to the task and going to the areas that needed their help most. Here, we have very many people from Cleveland Clinic who volunteered and spent a month in New York Presbyterian in New York City. We had a large contingency that is just about to come back from Henry Ford Hospital in Detroit, when they spent a month taking care of COVID patients. And this past Saturday, 45 caregivers flew to the United Arab Emirates to help combat a pandemic in the UAE. So there's a lot of solidarity, a lot of effort, and I think that was inspirational for those of us who had a chance to participate.
I'm inspirational, undoubtedly. excuse me. But I assume that at some point in the next year, there will be a number of reports filled with recommendations about what the federal government ought to do differently in preparation for a future pandemic. What kind of recommendations would you add to that list?
Well, there's several that are obvious. One is that we have to have a greater reliance on domestic production of critical equipment for healthcare delivery. In this case, it is personal protective equipment. It is we should never be in a position again when the safety of our citizens is critically dependent upon availability of a relatively simple, low-cost items that we know how to produce, such as gowns, gloves, and face shields. So that production, a really good part of production, will have to be kept at home, and we'll have to have a strategic reserve. And then the coordination of the efforts in detection, as well as in treatment, has to be greater. And lastly, I would say that if we think about the measures that worldwide that we have implemented in combat the pandemic, we essentially use the tools from 14th century to combat the biggest healthcare crisis in 21st century. The quarantine is 7 centuries old method of combating infectious disease. We have yet to use on a larger scale the tools from 21st century, such as our analytic capacity to produce, to accelerate new knowledge, to use digital technology. And I believe that there is going to be a lot of thought is being put in about how to leverage those capacities and our ability to address new and yet unknown pandemics.
Dr. Boutros, what recommendations would you have?
Well, I would echo Dr. Mihaljevich's comments. I'd also say I would add to that many of the pharmaceuticals need to have the domestic production capacity here. One of the things that will need to happen is the integration of our data across the entire nation of all healthcare systems, so we can share information quickly. This is in my career, in healthcare, and my life. This is the largest and steepest learning curve. Our knowledge that we have gained from one another is remarkable. And as Dr. Mihaljevic and you and I were talking before the program, we haven't been able. We've been just reading about this coronavirus and the implications, and we haven't been able to read anything else because of the increase in knowledge and information that we've had. So we have to have a better way of sharing that information than we do today, and have a little bit more coordination. I think we've developed some muscle memory here on how to do that, and that shouldn't go to waste. But I would also say to you, I have never been more proud of the U.S. response to this. We were able to shift agilely and saw obstacles and were able to create different solutions for them. And we did not suffer what other countries had to go through, like Italy. So I'm really proud of our overall response of our citizens and our nation and our state and our healthcare providers.
Is there something more you would have liked to have seen from the federal government?
Dan, there's always something more that you can do. I think they did the best with the information they had. I certainly would not have done as well as they would have. We had our visceral reaction to this, that we were so afraid that we're going to have to millions of people are going to be millions of Americans were going to die. That literally nothing could have been done that would have been sufficient to ease our fear. Only time Did we see that our measures are impactful, and we could get back to a sense of that we can manage this? But for a while there, it was sheer panic and throughout the country, and they did the best they can.
I want to ask you, though, how should then listeners understand the news out of Columbia University this week that had the federal government acted a week earlier, tens of thousands of lives would have been saved?
I would say to you is that had they acted 2 weeks earlier, more than that would happen. Had they closed the borders before the first case, we would have never had to close. We'd never have to shelter in place. And that's hindsight is 2020. You're dealing with live data and decisions. Dr. Mahalovic and I do deal with that all the time with incomplete information, have to make decisions on it. And as long as you act responsibly and according to your guidelines that has helped care for people, you make the decision and make the best decision you can, and it's never going to be ideal. So I would say to you is that some people think the governor should have closed the state earlier. Some people think the governor should have closed the state later, and they'll have arguments to both.
Dr. Akın is President and CEO of the Metro Health System. With us here at our Friday Forum is also Dr. Tom Mahalovic, President and CEO of Cleveland Clinic. You can join our conversation when you text your question to 330-541-5794. That's 330-541-5794 to text your question. You can also tweet the question at the City Club, and we'll work them in. You're joining the City Club Friday Forum from the studios of 90.3 WCPN Idea Stream in Cleveland. So getting to questions now, Dr. Mahalovic, pediatricians are worried about dropping immunization rates among children, and there may be a later outbreak of vaccine-preventable diseases. What are you hearing from parents worried about bringing children to the hospital or their own local clinic?
Yeah, both parents, all parents are worried about return to school. They're worrying about bringing children to the hospitals out of the fear of immunization. And my message, our message, I'm sure with Dr. Boutros will echo this, is that hospitals are safe. They're safe environments. We have to be very, very cognizant of the fact we have to be aware that chronic conditions and the conditions in general that need treatment even during the COVID pandemic. Immunizations for children should not be stopped. It is really important that we do not lose sight of it. The consequences can be for dropped immunizations and can be very, very severe. So I would encourage parents to bring their children for regular immunization.
Dr. Boutros?
The only thing I would add is that we are looking into ways into immunizing our patients at home. If what we want to do is reach out to everybody, and if they are going to postpone it just because they're afraid of coming in and we can't convince them to do that, we have to look at different ways to provide the vaccination to these children. The consequences for under-vaccinated infants and youth is really substantial.
Are we going to see a rebirth of the house call?
You already are. I think Dr. Mahalovic alluded to it, and Metro Health is doing the same thing. We're providing hospital at home and telehealth visits, which are like house calls through video conferencing. But we're also sending nurses and doctors into people's homes instead of them coming to the hospital. We're literally taking care of patients who would normally be hospitalized at Metro Health at home today.
A couple of questions have come in about telehealth. How do we keep telemedicine as accessible as it currently is due to relaxed regulations? And perhaps one of you can explain any regulations that were relaxed, while also protecting both patient and provider privacy and security. And also a positive outcome of the greater use of telehealth opportunities for treatment and provider-patient engagement, but how are hospitals ensuring that billing for mobile and online visits are happen appropriately?
That is a rapidly moving topic in healthcare. And I would like to say that the greater prevalence and the greater use of telemedicine has been enabled by one of the immediate actions of federal government when they have reacted on our recommendations as a healthcare providers that local restrictions about the availability of telehealth services should be lifted so that we now as a healthcare providers can serve any patient in the United States without the need that we used to have in the past when our physicians had to be licensed in different states in order to be able to provide their services for patients who happen to reside in the different states. This is really, really important because very many of our patients who live outside of the state of Ohio wanted to access our physicians and couldn't in the past, but now that is possible. There are obviously very many things that we need to do in the future in order to ensure that telemedicine continues to be a really important and effective way and safe way to deliver care. One of that is obviously to protect the privacy, and that is something that I believe we have already made significant strides in through the collaboration with a number of digital medicine platforms such as American Well. And I believe that the reimbursement will continue to evolve. So far, the reimbursement has actually been very good. But I do believe that we as a nation, the entire world has to embrace digital technology in healthcare delivery to the larger extent. And this is a journey that is begun, but there's a lot of work ahead of us.
Dr. Boutros, the idea of increased use of telemedicine assumes increased access to broadband internet, which is currently the city of Cleveland is ranked, I think, fourth worst in the nation of cities of this size. We spoke about this a few weeks ago with Eric Gordon, the CEO of the CMSD. How concerned are you with regard to the growth of telemedicine in the absence of real access to digital infrastructure?
Well, we very much are. That's why with the help of several funders, including Dollar Bank, we're making available both digital, broadband availability to 1,000 homes in our neighborhood, but also doing the training possible to do that. We're doing this to demonstrate that this is a better utilization of funds to keep people healthy by providing them this digital connection. It's the first of its kind in the nation, and we'll see if 1,000 homes is enough to demonstrate that this is really excellent use of healthcare funds and be able to have both insurers and CMS cover that cost in the future.
With regard to, this is switching to a public health question specific to the pandemic and how we approach it, both your institutions have had to integrate well with existing public health infrastructure. And with respect to contact tracing in Cleveland and Cuyahoga County, who is going to lead that initiative? Will it be hospitals or public health? And how important a role is that going to play? And are we prepared to do that work?
Well, contact tracing are always done. Typically, unless there's an outbreak in your own organization, is always done by public health. We work with the City of Cleveland and Cuyahoga County boards of health to look at these things. Terry Allen and Cleveland Clinic and Metro Health and University Hospital are constantly in contact every day. And I think we announced that we're doing all these additional testing. Public health is very much involved in doing the tracing for positive cases after that. I would say to you, it is something that people really, I don't think, recognize how good our public health system is in Cuyahoga County. We have some of the most dedicated, knowledgeable, and capable individuals. They have been able to increase their ranks significantly, and they're continuing to do so. So I feel very confident in their leadership and capacity to do the tracings.
Dr. Mihalovic, is there a silver lining to this pandemic at all?
Oh, I do believe that there is a silver lining to this pandemic. I think we have made a lot of strides in the way that we deliver healthcare, in the way that we share knowledge and resources, in the ways that we always wanted to do in the past but couldn't. Yet this pandemic has served as a catalyst and accelerator for a lot of good in medicine as well. And I'll just highlight a few things that we've touched upon that reflected that change. I think first and foremost, the adoption of digital technology as an effective means of healthcare delivery has skyrocketed. And that is a really, really good trend that we always wanted to see, had difficulties putting in place. The second part is when it comes to our own caregivers, the healthcare professionals. I do believe that the society as a whole has been reminded about the importance of the work that healthcare professionals do, that caregivers do, something that has been lost on many over the past several decades. And that restoration of faith in a healthcare profession is something that is very dear to our heart, and something that I think this pandemic has really accentuated in the best possible way. Integration of our healthcare efforts among various providers, I certainly hope that it is here to stay. I think the value of integrated healthcare delivery systems has demonstrated its effectiveness in the treatment of this pandemic. And lastly, our efforts in the community and understanding, a much deeper societal understanding that we will not be able to have a healthy society until we have our healthy communities, that every community has to be healthy in order for our society to be healthy. The importance of public health care efforts and community care efforts has never been clearer to a general public than it is today.
Another audience question, Dr. Mihalovic. Can you talk about the state of research on vaccines and how and what planning is being done now to ensure that any vaccine that is discovered and manufactured can be distributed en masse without chaos?
The vaccine research in the past used to be very, very slow, and used to be very slow because we used to use different methodology to deliver the vaccines. Development of potential vaccines in coronavirus has been nothing short than astounding. International collaboration is progressing at a fast pace, and currently we have several dozen different vaccines that are under investigation. Some of them are already in clinical use, and they're in clinical trials. Probably the one that has gathered the most attention is the vaccine that is coming from the company which is called Moderna. And this is a very innovative way to deliver vaccines. We believe that through new technologies, that the production of vaccines, which also historically used to be a rate-limited step, is going to be accelerated. With all of that taken into account, if and when we get a vaccine, the distribution is certainly going to need to follow the indications for medical need, and the distribution will have to first address the most vulnerable populations who are the highest risk of COVID infections, and those are elderly with chronic conditions, as well as the healthcare workers and healthcare providers. Having said all of this, it is important to remind all of us that having a vaccine is by no means a certainty. We do not know when the effective vaccine is going to come. We do not know if it's going to come, because coronaviruses have been around for a really, really long time. Common cold that each of us has experienced several times in his life is caused by a coronavirus, just not this type of coronavirus. Yet we do not have a vaccine for common cold. So this is not an easy task. We have to be patient, but we are also very encouraged by the pace of discovery that we've been seeing so far.
Dr. Boutros, can you shed some more light on the timeline that I think Dr. Anthony Fauci, said yesterday that he believes it could be here by December or January?
So I think that the Fauci and Dr. Mahalovic are are speaking about the acceleration of development of vaccine, and that's 21st century tools that we're using today to be able to develop a vaccine. And because this is such a worldwide phenomena, everybody's working with each other and collaborating. And finally, I would say to you this is that vaccine production, no one company is going to be able to produce enough vaccine for the entire world. So what I think you will see is that the first company that finds it is going to be able to lease out its technology to other companies to produce it. So that's why we will have mass production of the vaccine. So you will see collaborations, as you saw with hospital systems. You will see that in also pharmaceuticals, which typically is not collaborative at all. And then, while we're on a topic of collaboration, I want to really personally thank Dr. Mahalovic and Tom Zenti and their teams for working together with all of us during this time in the most exceptional way of caring about the community first and making sure we're all doing the right thing. This experience has been nothing but stellar.
Dr. Boutros, another question for you about health services provided at the county jail. These congregate care situations and places where it's almost impossible to do social distancing are causing a lot of concern. We've seen a spike in cases as well at the Marion Correctional Institution here in Ohio. Can you talk a little bit about about care being provided to vulnerable inmates?
Well, I honestly could not be more proud than the care that was provided at the Cuyahoga County Jail. Our first model showed that up to about 1,400 people would be infected. So we went to the judges and we worked with the administration and the courts and the prosecutor's office and the defense attorneys, and we were able to reduce the population to permit us to put people in single cells to create social distancing and the like. So then the number came down as we did that. There were less than 1,000 people in the jail, and the model showed that we could get up to 600 to 800. We started doing some very innovative things of isolating people as they're coming in and doing observations. And today, the number of coronavirus positive inmates is about 170 over the past 2.5 months, and we have had only one visit to the hospital, no major illnesses, and no deaths. So I'm very proud of what we've done. We've put the information together and have shared it with the Ohio Department of Corrections to implement similar protocols. But jails are not the only congregate living facilities in which there are risks. As you saw, nursing homes account for 50% of the deaths. That is why we are working to make sure that people are tested in the nursing homes and homeless shelters and other locations, also the staff, to make sure we keep it under control.
Another question for you, Dr. Mahalovic, regarding healthcare data integration. Can you speak to how the Cleveland Clinic and Akram Boutros, you on Metro Health, are both working to share data around social determinants of health and the coordination of referrals to social service agencies? Dr. Mahalovic?
Yeah, so we have been sharing our data, in particular during this COVID pandemic, I think better than we've ever had in the past. All large healthcare providers, UH, Metro, Cleveland Clinic here in Northeast Ohio, and numerous others in the state, we have all been sharing data about the COVID pandemic on a daily basis. And that has really been one of the most important determinants of our success so far, and probably being one of the best prepared states in the country to meet this new challenge. I do believe that data sharing and integration of data is just going to get better over time as our understanding as well as our digital sophistication in data collection, sharing, analysis, and data protection, which is a really, really important piece of it, gets more and more sophisticated.
Here's another question from the audience, from an audience member. You seem reluctant, this is really for both of you, but Dr. Boutros, we'll start with you. You seem reluctant to criticize the federal response to the pandemic. Isn't it true that the U.S. has not fared well in this crisis? Statistics show that we have 1/3 of the world's cases, that we didn't have adequate testing or PPE when it was needed, and that President Trump denied COVID was anything to worry about. When I compare our response to South Korea and Germany, we don't look so good. Please respond.
I'm honestly, I'm not trying not to criticize anybody. My point is to focus on what we were able to do and how we met the challenges. There, I'm sure, going to be plenty of analyses of what we could have done better, and those will take place, and we'll have lessons learned. I can tell you is that we assess our response at Metro Health and at the county and collectively every day, and we learn from mistakes that we've made and continue to improve. I am very, very proud of how the healthcare systems, how Ohioans in general helped reduce the curve. Actually, as I said before, crush the curve, and how our governor had worked with us and listened to us and worked to make sure everyone is safe and increase testing capacity. I know the clinic increased their testing capacity significantly. Last I heard is maybe the ability to do 9,000 tests a day. We're going to get up to 2,000 tests a day. So I'm focusing on how quickly we're responding to this and doing better. Do I wish that we didn't have a single case in the U.S.? Absolutely. Life would be much simpler than it is today, and more people would be alive today.
Dr. Mihalovic, the listener refers to South Korea and Germany. Are there specific lessons we can draw from their experience?
Well, I would say that when we take a look, first of all, this pandemic is far from over. I don't think that we can really responsibly tally up the effectiveness of individual countries in combating a pandemic. But what we have learned from a Korean model is what we have learned as we kind of look at the pandemic as a whole, that there is a lot of regional variability in the way that this pandemic has been addressed. And this really speaks about also to a certain degree about the cultural norms, behavioral norms, as well as an ability for governments and regulators to influence public health. Let's just speak about Korea just for a moment. Social distancing, wearing masks in public has been a norm, a social norm in South Korea for a really, really long time. The actual relative amount of testing that was done over there was relatively high, but it was not exorbitantly high. And they have been very good in being able to combat a pandemic without really shutting the entire economy down. They have closed the schools, but the jobs stayed open. Germany had a completely different trajectory, and a trajectory that is also reflective of their cultural norms. And an interesting thing about Germany is that they have more beds per capita, hospital beds per capita, than almost any other country in the world, for which they used to be criticized in the past by having too many hospital beds. In these particular circumstances, that turned out to be an advantage. And lastly, I would say that it's really important to keep a perspective about a pandemic. Nobody has really been prepared to address it. As Dr. Boutros said, folks have done, I think, the best they could with the information that they had in hand. From our interactions with government officials, both in a state as well as in the federal level, we have found them to be responsive to our suggestions, and they have implemented the measures that we suggested swiftly. I will say that our collaboration in the state of Ohio has been unprecedentedly productive. At a federal level, in 2 visits and 2 conversations with federal government. Let's say, for example, the lifting of the FDA restrictions for testing so that the testing can be done in individual hospitals is something that we brought forward. And the loosening of the FDA restrictions was lifted literally on the following week. And that has allowed individual hospitals to develop testing capacity and actually help more people in need. And then another good example is that we've asked to lift for the restrictions on the adoption of telemedicine to be lifted. And I have to say that the response was positive and immediate. And that has allowed us to serve many more patients across our entire country using telemedicine platform.
Excellent. Dr. Tom Mahalovic is President and CEO of Cleveland Clinic, and Dr. Akram Boutros, President and CEO of Metro Health System. I thank you both for your time today and for joining us for the City Club Friday Forum. We are going to leave it there, and I'm shocked that neither doctor mentioned the importance of hand washing and wearing a mask and keeping your distance. So having done that, we're going to close it out. I want to thank our sponsors, Medical Mutual and the Metro Health System, who sponsor our Healthcare Innovation Series. Our community partner is the Better Health Partnership. City Club Virtual Forums are sponsored by Cleveland Foundation, the George Gund Foundation, KeyBank, Nordson, and the Northeast Ohio Regional Sewer District, and PNC with additional support from the Char and Chuck Fowler Family Foundation. There are many more members, sponsors, and donors you can find at cityclub.org. Thank you. We're going to leave it there. I'm Dan Moulthrop. Stay strong, stay healthy, stay close in your hearts. If you can't, stay close in person. Our forum is now adjourned. Have a great Memorial Day weekend. Thank you.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
Production and distribution of City Club forums on IdeaStream are made possible by the generous support of PNC, the Chautauqua Institution, and the United Black Fund of Greater Cleveland, Incorporated.